Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula County Health Department's COVID-19 response. Today is Monday, April 6th, and this is my daily briefing. Currently, there are 243 cases of COVID-19 in Montana. We have 24 cases in Missoula, and 9 of those have recovered. Unfortunately, this weekend we shared some very sad news that one of our Missoula residents passed away from COVID-19 related complications. And again, our team wants to send our deepest sympathies to go out to their family and friends and loved ones in this very difficult time. So on that note, we know that this is a very difficult time for everyone. Things are really stressful. People are struggling. Some people are fearful or having a lot of anxiety. It's important to remember that while we're all staying at home to minimize the spread, we are separate, but we're not alone. So I want to take some time today and talk about resiliency and everyday physical and mental health and things that you can do to improve your physical and mental health during these really difficult times. So social distancing does not mean emotional distancing. I think it's really important for people to understand that you should try to stay as connected with family and friends as you can, just using the different technology that's available to you. Don't neglect your social ties just because we're social distancing. This is one of the reasons that many are starting to refer to social distancing as physical distancing so that we don't lose those ties and connections that we have with each other. Just because your normal routine is disrupted doesn't mean having a pattern isn't important. It's really important for you to come up with a routine at home. It doesn't have to be too regimented, but having set patterns is really helpful. It's important to exercise regularly, daily if you can. You can still go for a walk or recreate. You just want to make sure that you're staying that 6 feet away from other people that are not part of your household. There are things that you can do at home, like you could do yoga or lift in your living room. It's just really important to find some way of staying active. This not only improves your physical health, but it also improves your mental health in times like this. So both are key at times like this. It's important to unplug but stay engaged. So try reading a book or finding projects that are fulfilling and intellectually challenging. Think about the things that you really enjoy doing, and when possible, try to do them. Invest in some family time. Play games or find fun family activities to stay engaged with each other and promote positivity. I know sometimes that's really hard, especially for parents who, or even people who are not parents, when you're with the same people every day, all day long, sometimes it can get a little bit stressful, and parents who are trying to homeschool their children. So it's important to find activities where you can stay engaged and make it really positive and try to get away from all of the more stressful aspects of it. That being said, we also understand that sometimes you just need a little bit of space. So it is important to set aside some time to decompress. Again, when you're in the same house with the same people 24/7 because everyone's doing everything that we're asking to really promote that social distancing, sometimes it can get a little bit much. So set aside time that you can decompress on your own if that's what you need to do. Maybe go for a walk or listen to music. Don't isolate, but find some time that can be yours. Find healthy ways to relax. This is going to look different for everyone. For some people, exercise or meditation works to help them relax. So it's important to find what helps you have peace of mind. And also, it's important to make sure that you're getting plenty of rest. Allow yourself time for news, social media, and other sources of information, but give yourself a break from it too. It's important to stay informed, but also take breaks. It's really easy to get sucked into the news media, and it seems like there's just a lot of really negative information out there, and it can be very overwhelming, and it can cause more anxiety than help for some people. So you just need to know what your limits are and set some limits for yourself where you say, okay, I need to be engaged enough to stay informed, but I don't want to just be glued to the news all day long if it's causing you additional stress. Don't forget the basics like bathing and brushing your teeth. I know when you're staying at home 24/7, it's really easy to lose track of what day it is, and it's really easy for your routines to get really messed up. So whatever your regular daily routine was when you were able to get up and leave the house every day and go to your job or whatever your normal routine is, it's important to try and set those kind of routines for yourself. Simple things like feeling clean can really help support your mental well-being. Another thing that we can't discount is the importance of eating healthy. I know right now it's really easy to eat snack foods and watch TV. I'm not saying that's not a good thing to kick back occasionally, but eating healthy is really important at times like this. It can help you feel better. So eating fruits and vegetables, lean meats, poultry and fish, and whole grains is important. Do your best to try to limit your sugar intake. Gaining weight and neglecting your nutrition is not supportive of your physical or mental health at this time. If you're feeling stressed or anxious, please reach out. There are lots of resources for you out in the community. There are telehealth options that are available to connect you with counselors and therapists. Additionally, if you're concerned about food or housing, there may be resources available to you. So you can call 406-258-INFO. That is 258-4696. I actually think that that's wrong. I think it's 4636. And select option 3 or visit covid19.missoula.co for more information and resources. I do want to just give a little bit of an update. The CDC did change their guidance on masks for healthy individuals. They're now recommending that people wear cloth masks when social distancing of 6 feet or more is not easy, such as when you go out into public to get supplies that you need, like going to the grocery store. This does not mean that we recommend for you to wear N95s or surgical masks. It's really important to maintain those for healthcare workers and first responders. We also want you to recognize that this recommendation is to prevent healthy people from unknowingly spreading the virus through pre-symptomatic spread. So if you remember back to what we were talking about on Friday between the difference between asymptomatic and pre-symptomatic spread, this recommendation came out from the CDC to basically say, okay, for a couple of days before you start having symptoms, you could potentially be spreading COVID-19. So wearing cloth masks is to prevent that pre-symptomatic spread. You'll probably see this evening on the news. We're going to be talking this afternoon with some of our partners about some additional testing resources. So I will be talking more about that here in detail tomorrow. And that's pretty much it for my daily briefing. So you can subscribe to me on YouTube to get these video notifications. You just have to click the little bell. My YouTube channel is under my name. That's Cindy Farr, CINDYFARR. Follow us on Facebook. You can just search Facebook for the Missoula City County Health Department. You can go to our website, that is missoula.co/cvirus for more information. And again, you can call that 258-INFO line, and that is manned by real people from 8 to 5 Monday through Friday, and they can help answer your questions or direct you to additional resources. So until tomorrow, everybody stay well and healthy.